Good morning, Coalition, as David always says. So I feel like I want to start off and kick us off that direction. Thank you, everybody, joining us today. We know more people will be rolling in as we start today's interview. Obviously, for those of you online watching it, thank you for joining us today for this interview. We're excited. We have a very special guest today. Ted Goins is going to join us. He's the president and CEO of Lutheran Services Carolinas. I do want to take a minute and remind everyone that we do have an upcoming coalition meeting on May 20th. So please join us for that. We look forward to hearing more about all of your different adventures since our last coalition meeting, and certainly all the different work groups and their work. So we're excited. But why don't we kick in? It is Friday morning, so we want to get everybody kind of rolling into getting a chance to learn a little bit more about someone many of you may already know a little bit, but probably not as much as you're going to know after today's discussion. So really excited again. Thank you, Ted, for joining us. This is Ted Goins, President and CEO of Lutheran Services Carolinas, and we're excited to get to know you a little bit today.
Thank you. Good to be here.
Awesome. Well, today kicks off Nursing Week. So we also want to do a big shout out to all of our nursing providers and healthcare providers. It's a health provider role very important in your story. And this year's theme is You Make a Difference. So I would love to hear about the path that brought you into life of service and how you make a difference today.
It's just so good to be here, and it's so good to see so many faces on here. And I've spoke to a couple of you already this morning. I see Heather on here, who I work closely with also. So it's good to be with a friendly group this morning. And it is Nurses Week. It's National Nursing Home Week is along this same time, and also Older Americans Month. So it's really a time, and especially since Lutheran Services Carolinas started in 1960 with one, matter of fact, it was the first skilled nursing assisted living in the state of North Carolina, the first combination facility in the state, built back in 1960. And I remember the story that the state inspectors couldn't decide who was going to inspect it. Was it going to be the rest home people or the nursing home people? So we go back a long way. But we started in senior services, and that's still the largest piece of what we do. And so Older Americans Month, Nursing Home Week, and Nurses Week, all that is very certainly near and dear to our heart, especially after the last 2 years of pandemic, when those nurses and other healthcare workers especially, I mean, all of us have suffered, but especially, and even today, nothing much has changed in the skilled nursing world, where people are still masked and goggled and not able to do what we would like to do, and certainly not able to provide for our residents as we would like to. But our mission, I'll start with our vision statement. We are a faith-based health and human services provider, and we do a lot of different things, but our vision has been the same since 1960. And that's biblical. You don't have to be Lutheran or Christian to work for or be served by Lutheran Services, but we have our roots there. But our vision from John 10:10, I came that they may have life and have it abundantly. And so abundant living is something that we talk about a lot, is to what we want to provide for everybody that we serve, not just the basics, but that cherry on top, that abundant life that we all want. And just because you're in a facility or being served or a vulnerable population doesn't mean that you don't deserve that cherry on top. So that's what we've tried to provide through Lutheran Services Carolinas.
So it's beautiful. So how did you get, so your own story leads into this, right? Feels like it leads very logically into that journey.
Well, it's my parents' fault primarily, but I'll blame it on my whole family. My dad is a Lutheran minister. My uncle is a Lutheran minister. My mother should have been a Lutheran minister. We called her the Reverend Mother growing up because she was very much in that mode. I think I was the 17th member of my family to go through Lenore University in Hickory, which is the Lutheran, our local Lutheran school. So I didn't really have much choice but to be in somehow connected to the church. Now, Mom wanted a preacher, but that just wasn't in the cards. The good Lord knows best on those things. But I got a great education at Lenore, and as a matter of fact, one of my professors When I needed money, he said, well, I know a nursing home right down the street that needs help. And so I went down there and immediately, and this was like 1978, I guess, toward the end of my junior year. And I got a job as a nursing assistant. Now that was before there was a C on the front, a certified. So I actually, matter of fact, they put me to work that day. I was actually on the hall working with somebody, but providing care that day. Thankfully, we've come a long way since. I should not have been allowed to do that, but that was a different era back then. And so you kind of got thrown in, but I just fell in love with the work. And I've really never left it. That's really all I've done right out of school. It eventually got my nursing home administrator's license and worked as a nursing home administrator, and then was fortunate enough to be named president of the company back in 21 years ago now. So I've been in this role for 21 years.
Well, congratulations. And
Yeah,
I mean, in that role, you do a lot of support with healthcare providers, right? You do a lot of support with a lot of institutions. So you mentioned COVID, like in addition to responding to the impacts of COVID on the workforce, you've been an advocate for home health and long-term care workforce. Can you share kind of, especially somebody who's had some of that experience, can you share kind of your motivations in that and kind of what you see happening right now?
Yes, and you know, I kept my, matter of fact, I eventually got my CNA just because I felt like that was important, and since I started that way, I kept it for over 20 years. Sadly, let it lapse, but I still shadow our folks regularly. But I was a CNA for over 20 years, and so you know that's where I started that, and that's where my heart is. So I know our people, and I know what they go through every day, and that is a hard job. As a matter of fact, every time I try to break it down and figure out how to do it better, it's just an overwhelming job. You can never go home at the end of your shift and have done it all. You can't say I finished the job. You just have to hand it off to the next shift, because the work is never ending, and the needs are never ending for just like they aren't for us individually. So you know, but we had a workforce shortage long before COVID hit, and it was already getting bad. COVID just dug the hole deeper for all of us, and even now with the great resignation that people talk about, and the competition for employees, and you know, we don't want the bottom of the barrel taking care of our most vulnerable citizens. We want the best people taken care of. My mother lives in one of our facilities. My aunt and uncle live in one of our facilities. But I don't care about that. I want every resident to have the very best, and you can't have that if you're hiring really the last person that comes in the door. So I think the workforce emergency, and I know Heather and I have worked very closely, and Mary, on this for the last well, my whole career. This has been an issue my whole career, but in the last 4 years especially, it has just gotten critical. And I think I'd also like to make that difference, make a distinction between people that provide 24/7, 365 care, because that's the hardest of the hardest. Because if you're already finding it hard to find people, and then you want people to work on second shift and on third shift and on Saturday night and on Christmas night, it really takes even more, and it takes a dedicated staff to be able to work all that time. So workforce is my issue. I don't want it to be, but it is the biggest issue out there. Therefore, it needs to be my biggest issue.
Well, it sounds like a testament again to your commitment to service, and certainly recognizing the needs and the dignity of individuals who are in care and all of that. So what would you say are the key solutions then? Is the key solution to, you know, is it financial? Is it about support networks? Is it institutional? So if you were to say kind of solutions that you're advocating for, what would those solutions be?
Well, you know, for me, I try to look at the you know, what is the cause and what is the effect, because it's easy to try to solve a symptom, but the symptom's not the root of the problem. The root of the problem, unfortunately, is that most, and we're the same way, we are passionate about serving the least of these, but that means Medicaid residents are the largest, group of people. The indigent are the largest group of people that we serve, and therefore Medicaid reimbursement is key. If it's not adequate, then you can't afford to hire the kind of staff that we want to have, and especially right now when you can't find anybody, hardly at any. Well, certainly, in that 14, even in that $14-15 range. We've got a new, and everybody's got one. We've got a new Chewy plant, the pet supply company that just opened up here in Rowan County. And they're starting people at $17-18 an hour. And here I'm trying to hire CNAs we finally got them to 15, but they have to work, nights and weekends, and that makes it tough.
So would you say that is the dominant issue kind of pressing about the workforce?
I think reimbursement is two things. It's reimbursement, because we've got to be paid enough money so that we can do the job, and that we can afford to hire the people that we want to hire. But the other side is just having enough workers. And frankly, there are not enough workers in this country. About 1/4 of the long-term care workforce in this country are immigrants. And yet over the last, especially the last 5 years or so, we shut down immigration. And at a time when, I'll never forget, this was long before that, Dr. Johnson at the business school at Chapel Hill, I've heard him speak a number of times. And he said to our board, we actually were so thrilled with him, we brought him in to speak to our board, and he said to a board that's mostly older people, he said, you people either need to start having babies or open your border, open the borders to this country. That's your two choices, because the birth rate's going down, more people are retiring, the population is aging, so you've got to have more workers. And there's only two ways to do that: have babies, which most of us are beyond that time, or increase immigration. So I've started talking a lot about even if it's just an emergency foreign guest worker program, something that would allow us to bring people in specifically to work in healthcare. And frankly, in my case, in mostly that 365, 24/7, 365 work.
No, it's really powerful, especially when you talk about the intersection with immigration and refugee experience and rights, in those conversations that are happening. Is there a way that the coalition can be a support in that conversation? Is there a way that we can be a support in that workforce conversation?
Absolutely. And I know a number of you on this call are already doing that, but I just had a call with we've got about 1,800 employees across North and South Carolina. The biggest thing we do is nursing homes, but we do everything from developmental disabilities, which has the same issues with staffing, to foster care, to refugee resettlement, to disaster work. So just a little bit of everything. And I told them that our two emphases for this year have got to be our culture, which we feel like our culture is strong, but we've got to continue to push, because that's all we've got is our culture these days. But culture, and then advocacy, that we have got to tell our story louder, which is why I'm thrilled to be able to tell it to you all, even though I feel like I'm preaching to the choir, because you get it, and so many of you are already, I suspect all of you are already involved in that. But just making our voices heard, that we just can't continue like this, that there's going to have to be a restructuring of priorities if we want to take care of the most vulnerable people in our society.
Well, first of all, I think it never hurts to hear it. I think all of us believe it, and I think it never hurts to hear it. And it's a lot of energy and effort that goes into that process. So I'm gonna ask sort of personally, like, how do you replenish that? It's hard to stay in this fight for as long as you've been in it, to commit down and do the community organizing and the kind of work you're doing with congregations. what do you do to kind of, again, kind of replenish the well and kind of stay in it? I know that can be challenging.
Yeah, well, thanks to I think my wife would have to answer that question, because she's the only one that keeps me out of my office and doing something different and staying. I was telling you right before we came on the air, I just got back from England. My grandchildren live over there, and in my other life, I am pappy, and so just to really get away and take a break. The other thing that is probably a little bit more unusual is I do try to spend time with our staff. I work a shift in our facilities once or twice a year. I've got a full-time job, but I wouldn't give that up for anything. I go and spend an 8-hour shift with our people, and it's not gotten, matter of fact, it's gotten harder than it was when I was doing that 40 years ago, sadly. I'm 64, and a lot of people my age have given it up, and I've given that some thought too. I mean, I'm close enough, I could probably pull it off, but I just can't imagine leaving our ministry and our organization with in this shape. I want to leave it better, and as a matter of fact, I've thought about, when I do retire, that this might be my next thing, is to spend more time on advocacy, because I can't think of a bigger need in our society.
That's really interesting. You mentioned that too. You talk about, again, kind of even just generational wisdom, right? There's a lot of wisdom in the work that you've done, many of the coalition members have. How do we get younger communities? How do we bring younger communities on board to this conversation so that they recognize this is multi-generational? We're talking about caregiving across generations. Do you have any, are you looking at different strategies to try and bring in, again, new leadership, diverse leadership that is starting to have these conversations?
You must be reading off my desk over here, because we started a couple things that we're just trying, but we don't certainly have the answer at all. But about in the last couple of years, we've started a Next Generation Leaders Council of young people in our organization that might be, we talk a lot about every one of our 1,800 employees, teammates, are leaders, every one of them. That housekeeper, she gets to lead many times a day. That that maintenance person gets to lead. Sometimes I get to lead. Oftentimes I get to follow. We're all in that same boat. So we've really started this Next Generation Leaders Council to try to lift up those new leaders, try to train everybody at leadership, but also to lift up those that want to be involved a little bit more, to grow as leaders and maybe be the next generation leadership for this whole organization. At the same time, and I've thought about combining them, but we also put together what we call our Diversity Council, which is looking at obviously like a lot of people are these days, at diversity, equity, and inclusion, and a lot of times those agendas look exactly the same for those two meetings, because we're talking about leadership, and we're talking about just lifting up the next generation of leaders. It doesn't matter what color, gender, what part of the organization you're coming from. So we're passionate about trying to lift up our own leaders and get the word out to the world like this in what we're trying to do.
What would you say the biggest challenges are? Like, what are the challenges that you feel like you face the most? Is it infrastructural? Is it just financial? Is it investment?
I think some of it is that financial, but a lot of it is just, our society today seems to be more intent on taking care of me, taking care of ourselves, and I don't want to sound like that old man that I'll start shaking my fist if we go, but finding ways, but young people care too. They just care differently, and they don't stay with organizations 30. I'm going on 32 years this year in total with the organization. So people don't do that anymore. So finding how to engage people on their on their terms for as long as they want to be involved, and knowing that it won't be the way it is for the way it was for a lot of us.
No, I mean, it's definitely a challenge I think many in the organization share. But like you said, there is a commitment to a variety of different intersectionalities within serious illness care. I know for you, immigrant refugee experience has been something that's informed your own work. Can you share a little bit about how you mentioned earlier about trying to expand the workforce, but you're also doing a lot around refugee resettlement? Can you share a little bit about sort of the influence and the passion you have toward that work?
Well, and again, I have to blame it on my family. My mother was actually on the board of one of our predecessor organizations, Lutheran Family Services, when we started doing refugee services in North and South Carolina. That was in about 1979, and that was with the Hmong Vietnamese refugees coming over after the fall of Vietnam, and my mother was on that board, so I've heard it my whole life. And then all of a sudden, we merged these organizations together, and all of a sudden, I'm working with refugee services. And now, especially with the workforce crisis, all of a sudden, I'm seeing two completely different sides of the organization that really have had nothing to do with each other. All of a sudden, there's their chocolate and their peanut butter are looking like something that could really work well together, because these refugees are coming to our country. We just resettled a record for us, about 750 Afghan refugees into North and South Carolina, about half in each state. So they're not huge numbers, but they all need jobs. They all need homes. They all need, to start a new life, and they just want an opportunity. So we are trying to work with different organizations. If we have facilities close by, to refer them, those folks, if they want a job, but also if not us, then others. And I know even our American Healthcare Association and our North Carolina Healthcare Facilities Association here in North Carolina are both working with refugee providers to at least make that option available. Again, then it gets back to money. I was so disappointed. I'll give you a great example. In Raleigh, we don't have any facilities in Raleigh. So I reached out to some of my friends in the nursing home business and said, I can provide you with some potential employees through our refugee office in Raleigh. But in the meantime, we had people coming to us, employers coming to us and saying, I'll hire your people today for $15 an hour or more. And they don't need any training for the work that they were going to provide. So all of a sudden, nursing homes again lost out to other employers because they could pay more. We had a restaurant, a hotel chain that reached out and said, we'll hire everybody you can send us, because they would probably start them in jobs that, like housekeeping, hospitality, where you wouldn't necessarily need, and especially back of the house, where you wouldn't need the better English skills, to get started. So again, we've got to get more competitive, and sadly, it's all about the money.
Well, and obviously the impact that the state legislature has on some of these decisions and some of the funding. Have you felt like they've been receptive to this conversation? Do you feel like you are getting heard in the state legislature? I can't say the word today. State legislature.
I think the legislature and the regulators understand our issues. Again, it's just a matter of there's a certain amount of money, and how are you going to allocate it? And raising taxes is not on the cards with our legislature, and so it really is a kind of a how do you get past that stumbling block? I know Heather and Mary, a number of folks on here have been involved. Last year, we made a huge push, and it was the first time that we got everybody to the table together. Folks that work with developmental disabilities, don't necessarily talk to nursing home people or assisted living people, but we all came together because we all hire the same people. And we said, we've got to have Medicaid and state reimbursement to pay $15 an hour minimum. Now, I don't think that's enough anymore, but we failed at that because it would be recurring money it would be a huge price tag for the legislature recurring. Now, they did give us enough to do about a $2,000 bonus for a lot of the staff, direct care workers that worked during the pandemic, but you had to work in the same location for a pretty considerable length of time during the pandemic. And so if you change jobs, even if you went from one nursing home to another, you did not get that bonus. And,
wow.
and they also said that nurses were not direct care workers, which caused a tremendous problem for all of us who love and employ a lot of nurses. It's kind of hard to tell them they're not direct care workers. I realize they make more money, but when you're talking about rewarding, a state reward for working through the pandemic, it caused some problems. But for the people that got it, my goodness, to get $2,000 for a nursing assistant, to get $2,000, it was a blessing. So we made some good progress, just not enough. We got partly up the hill, just didn't get over the top.
Well, and that message is particularly, again, salient. This is Nurses Week, so I think we want to definitely recognize and honor all of our nurse practitioners and their assistants and everyone involved there. So certainly making sure that people hear that and that resonates with them. I do want to open it up if anybody does have any questions that they want to hear from Ted. I certainly I have plenty more questions. Ted, you've been so generous with your time, so generous with sharing your story, your perspectives on all this. So I cannot express enough gratitude for you to be here today and celebrating this Friday Facts with us and celebrating Nurses Week. Does anybody have any questions they would like to ask? Otherwise, I have one more. I have technically like 5 more, but like, but I know we have a couple minutes left. All right. Well, I'm gonna ask a little
Shana,
bit.
this is Mary Bethel. I don't have a question, but just a comment that Ted has been a phenomenal leader in healthcare and nursing home care for years and years, and we're so lucky to have him in North Carolina. And he's a great spokesman for all the issues that are going on now, and hopefully, we could clone him. So anyway,
thank you. That's awesome.
Asset.
Thank you. I've just tried to follow your example, Mary. Thank you.
Well, and as a mentor, as we talked about, as we bring in, again, additional leadership and sort of widen the bench and deepen the bench and get more voices in the mix. Obviously, Ted, your experience is phenomenal. I do want to mention our next Friday Facts coming up is Anirus Riddick, who's the executive director for Faith Action. So I think is very resonant with some of the conversations we're talking about, people with immigrant and refugee experience. And so I just have one last question, I guess, for you, Ted, which is our one last question for today. We'll have to get together and I have many more questions. But one last question is sort of, as you talk about the sort of resettlement, that not only includes individuals who obviously can be entered into the workforce, but it also includes people with serious illness care. That people are coming in from nations and situations where their health certainly has been impacted by war, by a variety of factors. And so many of them are entering into serious illness care. Any suggestions or thoughts around how the coalition can be advocates and support in that conversation?
That I am so glad you asked that or mentioned that. And because yes, we have some people that come that have very serious illness. And a lot of mental illness also, and some of that is from the like post-traumatic stress disorder type things. I mean, these people have escaped from being threatened with death, at least persecution, and oftentimes escaping certain death. And so you can imagine trying to rebuild your life from that. And we're getting ready to see that again with a wave of Ukrainians that is probably going to follow right on the heels of this Afghanistan situation. And so we've got to be prepared for that too. So yes, I think maybe some part of this group gathering all of our refugee resettlement agencies together to maybe have a little discussion about how we can work together to best serve these folks that are coming in, because they don't just need a job and a place to live and some food. They actually need care, and a lot of times that's major, chronic or critical conditions, and certainly the mental health piece.
Thank you for sharing that. I think that's actually great, great for all the coalition to hear, to sort of bring that into the fold and in that conversation, because as you said, there's so many different, long-term care concerns and considerations that these community members, who are new neighbors, need to be addressed. So thank you so much for taking your time today. Thank you everybody in the coalition for joining us. Ted, again, thank you for sharing your time, and we look forward to talking to you in the future, and look for this online, and we look forward to connecting with you, Ted, at a future coalition event, and more of the coalition members at our monthly meeting in a couple weeks. Thank you, everybody.
Thank you very much.